So my favorite topic to talk about is brain health. From somebody that had a lot of brain damage and was disabled for a lot of years, I found my way back through the woods and through all the disability, first through brain health. And I found that I could actually do brain training for hours a day instead of just 20 minutes twice a week and grow new tissue and gain abilities back. So since then, I have paid that forward over 1,000 times to other families that have disabilities that are trying to get their life back. So literally any condition in the body can be traced back to an irregular brainwave pattern. And so we are born wired for success, most of us I would say, and then over the course of our life we have different traumas and things that are upsetting us that reprogram our brain for failure. And so now we are nothing but a sum of all the traumas we've ever had. And so when you go through life and you find yourself getting close to one of those traumas, subconsciously of course, you don't have to put the dots together, your brain gets hijacked and you start acting and behaving a certain way because it reminded you of something that was harmful in the past. So now we have the ability to look at the brain so intensely. We can literally break the brain down into 2,800 little tiny cubes of a 7 millimeter cube of tissue and see what each and every one of those are doing or not doing. So when somebody has some kind of brain trauma, there's basically 5 things the hospital will do to look at you. They start with an x-ray, make sure you didn't break your skull. They do an MRI to make sure that there's no cuts or lesions or something in there that's not supposed to be there. However, the MRI does not tell us how anything's functioning, just what it looks like. They might do a CAT scan to see if you're bleeding and hemorrhaging somewhere. They might even do a functional MRI to do the same. However, the QEEG, which is the quantitative electroencephalograph, is the only test that they can do to determine how is our brain actually functioning, what's actually happening. So we have the ability to take 19 channels around your brain, record over 60,000 neural synapses every 100th of a second, and build a 3D image of your brain and literally peel layers back and tell you everything about your world and your life. But not only that, we can use that information then to target parts of your brain and grow new tissue and give you abilities back, ones that you may have thought were gone forever. In fact, 7 years ago, I would have bet my life I'd never walk again, and now I'm completely pain-free and have all the abilities to do everything I've always loved to do before my injuries. So if you're somebody that's ever had a brain trauma, or somebody that might be getting forgetful, there's lots of things that disrupt our peace of mind. It could be a physical trauma, which is usually the most common. It could be a chemical trauma like heavy metal poisoning. It could be an infection. It could also be chronic emotional stress. Will absolutely change the picture of your brain over time. So if you've never seen a brain map, I encourage you to come on in and let us give you a look of what's going on in your brain. Not only can we tell you every bit of neurological function or lack of, but we can also look for heavy metals, we can look for infections, we can look for which tissues were damaged, and then get a plan of action for how we can help restore and rebuild that brain before it's too late. There's definitely a point of no return once the damage has slowed down activity in the brain. We can't build new tissue on tissue that's not talking. So again, I encourage you, if brain health is an issue for you, I encourage you, come in and get a QEEG and let us see how we can help you today. Thanks.